Hello and welcome to Wellbeing, your one source for important health discussions. I am your host. My name is Mary Joseph, and today we are diving deep into a topic of utmost importance, and that is the World Contraception Day 2023. This year, World Contraception Day carries a powerful theme, that is the power of option. It is a theme that resonates far beyond the realm of contraception itself, as it shines a spotlight on the crucial role that contraceptive choices play in empowering individuals to take control of their reproductive health. As we mark this important day, it is essential to recognize the significance of providing a range of contraceptive options to individuals, allowing them to make informed decisions that align with their unique circumstances and aspirations. Now, this theme not only is about contraception, it is about fostering autonomy, enabling informed choices, and also advancing global efforts towards reproductive health and family planning. Join us as we explore the varieties of contraceptive methods available to ensure that people can choose what works for them best, taking into consideration factors such as lifestyle, health considerations, and future plans. We would also be here to provide accurate and comprehensive information about each contraceptive method to empower individuals to make informed decisions. It is also important that we all bear in mind that the theme, the power of options, is more than just a theme. It is a call to action. Now, on this World Contraception Day, let us celebrate the strides made in empowering individuals to make choices that align with their reproductive health goals. Do remember to be a part of the family by following us on all our social media platforms at Spectrum TV, or you can visit our website at spectrumtv.ng. Let us just quickly go on a short break. We'll be right back.
Good health, they say, is something you can't buy. But the decision to live healthy is a choice that you have to make. Join health practitioners from diverse health fields as they provide you with vital information to help your day-to-day health decisions on Wellbeing, your wellness talk show. Wellbeing airs every Monday, 7 to 7:30 p.m. only on Spectrum TV.
You're welcome back to the show. It's still the program Wellbeing, your wellness talk show that is designed to keep you health conscious. Do remember to follow us on all our social media handles at Spectrum TV, or you can visit our website at spectrumtv.ng to be a part of the family. Before we went on the break, I introduced the topic of discussion, and today we would be joining hands with the rest of the world to mark this year's World Contraception Day. And trust me, we have a compelling and informative show lined up for you today. We are honored to have a distinguished guest who is here with us. He is Dr. Ikechukwu Okpara, who is an expert in reproductive health and a passionate advocate for informed family planning choices. Welcome, Dr. Okpara. It's good to have you here with me right here on Wellbeing.
Hi, Mary. It's nice to be here. Thanks for having me.
Welcome. So first off, can you tell us about this year's theme? The theme for this year's World Contraception Day, the power of options, and why it's so significant.
Yeah, thank you for having me once more. The power of options, I think, is good for people to know the options they have. Most people have myopic view of contraceptions and contraceptives. There are so much misconceptions. So it's good for us to build awareness and enlighten people of the options they have and the rights they have to contraceptives. So I think this is a good team that should focus on us creating so much awareness for women to know that there are so many options. That this doesn't work doesn't mean that all will not work for you. Thank you.
So can you tell us now, why is it crucial to provide a variety of contraceptive options to individuals when it comes to family planning?
Yeah, the reason for the options is because there are many reasons for family planning. And so it depends on what you want to achieve. Some people might want to do family planning and also want to get protected from STI. That means pills will not help you, condoms will have to be used. Depends on your body system. Maybe there is something you have that oral contraceptive is not allowed. Maybe for a breastfeeding mother, a combined oral contraceptive is not allowed because the woman is breastfeeding. Maybe for a woman that is bleeding, that have heavy menstrual cycle. So because of the different presentations of women, there are different options to suit all presentation. Someone might not like injections, he has options of an implant. Someone might not like surgery, he has options of oral pills. Someone might not be good at remembering to take pills every day, he has options of implant. So the options make it like to try to suit different conditions, different presentations of women.
Over the years, the power of education and also the role of informed choice is emphasized in reproductive health. How can accurate and comprehensive information about contraceptive methods empower individuals?
Yeah, I think education empowers people, information empowers people. So when people know what is available for them, when people hear the right information, the right message about these contraceptives, it gives them that kind of courage to walk into a health center to ask. And when they ask, they know what they're asking for. Because for now, there's so much misconception. The last place I worked in Nigeria, in Abia, I was a lead in family planning services then. So it was an issue. There's so much misconceptions about women that took family planning and could not deliver. It can cause infertility. It can cause maybe you stop seeing your period. So all those things are things that kind of discourages people. So, but if people have the right information, they have the right usage of contraceptives, they have the right things to do. It gives them that boldness, and that is what and it's easy to convince someone that is already informed. Yeah.
Now, you actually bear with me that the role of healthcare providers can never be overemphasized. So, what role do healthcare providers
Sure.
play in ensuring that individuals have access to unbiased information about contraceptive? Now, when I say unbiased, I mean unbiased, especially to young and adolescent women, women who are not yet married, and also young people in general.
So every healthcare provider is trained based on his like for doctors they have the Hippocratic oaths, they have their oath that supersede their beliefs. That is the way it is. So that even if your belief system doesn't allow you to prescribe this option, you could refer. If you don't want to do it, you could refer. But you don't block women from accessing because you don't think is morally right. I had that issue when I was working in a place. I see how people frown at a young lady that is not married coming to ask for condom in the facility or asking for contraceptive. Everybody looks at her like, oh wow, you're having sex. Once you ask for contraceptive, it means that you're sexually active. But not everybody, majority of youths are sexually active. But the few have the boldness to come to ask for this. And we also want to come again. We are hollering, we are against people having unsafe abortion. So how can we prevent this? So I think professionals should know that they are professionals. They should remove sentiments apart. They should remove beliefs apart and give the right information. So that in counseling, you don't make the choice. You give the person an informed, and you have the person to make an informed decision by giving the person the accurate information that is well up to date on what is available. And don't I also the other thing I notice people do is that they force you to take what is available in their facility. So
Yes.
let the woman know what is available everywhere. Then if she doesn't want the what is available in your facility, you can refer. For example, or if you're not competent in doing what is available, so like you're not competent in doing IUD, you're not competent in doing an implant, you can only prescribe pills. Then the woman comes to you, you channel your counseling into taking only pills, but she never knew that there was IUD to take, there is an implant to take. So make your counseling to be comprehensive and be willing to refer. Thank you.
Now, that leads me to my next question. How do you see the intersection of reproductive health and human rights? Because contraception is for everyone. It's their basic human right. So why is it important to uphold human rights principles in contraceptive services?
Yeah, just like you rightly said, that contraceptives, reproductive health is a right, is a part of human right and is a right of every woman. So when I was in Abia, what we did was that when you're talking about human rights, there are pillars that if you want to make human rights to thrive, there are pillars that you should work with. The religious leaders, the community leaders, the government. These are strong stakeholders you need to work with. So religious leaders can have a way to be part of advocates. So all we did was we have to build an advocate for family planning. So we had selected religious leaders of areas and community leaders and government and well-known stakeholders. When we notice that when these people speak positively for family planning, for contraceptives, most women tend to turn around and change their mind. Like if a pastor could talk about family planning in his church, you know how much people that will access family planning. If a reverend father could talk about family planning in the church, you know how many people that will access family planning. So when we talk about the rights, these are the pillars that can affect the right of women. If the community leader can say family planning is the right of the woman and no woman should be denied of family planning, it will be easier for the woman to claim her right. If the government can make avenues where people can complain if they refuse family planning services, it will help. So like these stakeholders have to work together to ensure that these rights are made accessible and affordable for women to take.
So now, in your journey as a public health provider, can you share some examples of how discrimination and also coercion in contraceptive services can negatively impact individuals and also communities?
Yeah, so I have there's a scenario I witnessed or I heard about. A young lady that came to the clinic there. I think we're having an outreach for family planning. So she came there and I think someone knew her from there and like, what are you doing here? You're single. And they denied her access to family planning services. Then the same lady came months later with complications of abortion. Now everybody is blaming her for conducting abortion. But we could have prevented this abortion if we gave her access to family planning services. So when we prevent this access to family planning services for these women, we're not helping them. I've been to an immunization clinic. I saw a lady, a woman with nine children, and I was surprised that she was just hearing family planning for the first time. So I had to ask the immunization officer. I think we also have to integrate family planning in immunization units because these are where these women come to. So how can you see a woman that has 9 kids and you've never talked to her about family planning? That so like if we integrate family planning in other service delivery points in the hospital, it will help to catch them and make it accessible. Yeah.
All right. Now you mentioned something about making family planning accessible. So what are some of the key challenges in promoting choice-based family planning? Because one, accessibility is one thing. Then we also have the role of spousal support in obtaining family planning services. Now, how can all of this be addressed?
Yeah, so you mentioned too, but when I was working in Abia, deny, that's the costs. Family planning services should have been free by Nigerian government as agreement with the international bodies. It should be free. But when you go to the communities, it's not actually free. They have to find a name to tell you to pay for a car so that they don't want to ask you that they are charging you. Why some actually tell you that you're going to pay 2,000, 500, 1,000. So these things in the community, some women cannot afford this. So when you tell a lady that you try to convince from the community that makes merely 200, 1,000 naira a day to pay 2,000 for family planning services, she will not do that. Then the issue of accessibility. If government could, that means that we need to, from what we noticed in Abia, there was need to train more service providers so that the government did well by doing what they call the tax shifting and tax sharing formula, whereby they choose the health extension workers are trained on providing family planning services. So and also the nurses. So there should be more training because in Abia, when we did a need assessment, we noticed that they had only 54, less than 54 nurses that were trained on family planning services, on the longer teams of family planning services, out of more than 500. So if you don't have people that are trained, that means your access will be limited. Then most facilities are also not accessible. Either they have bad roads or the location or the timing. Most facilities are closed before 12 in the rural communities. So most facilities are also, and one will also discuss access. We try to understand the context of the facility in the sense that in rural communities, they have the market days. So you cannot put your family planning day on the market day of the community. So all those things have to be put in context. That if you're making a family planning day, try to make it in a day that people always come to the hospital. Maybe the immunization day or something that don't have to have anything with the community.
Okay.
Then the government also need to build the structures and provide the resources. Thank you.
Okay. So if you are go so if you go on the streets to ask anybody what's like the definition of family planning, they'll
Yeah.
link it always to birth spacing. And indeed, birth spacing is essential for maternal and child health. Now, could you explain how
Yeah.
adequate birth spacing contributes to healthier families and also healthier communities, healthier mothers, healthier children?
Yeah. Birth spacing is very essential in the time as now that we're talking about maternal mortality, because when a woman spaces a child, it gives the woman time to recuperate. A woman is not just meant for procreation. She has a career, she has a life, she has other kids to take care of. So she needs that time to rest, to plan herself. Then when there's an unwanted child or wanted pregnancy, this is not the kind of love you show in a pregnancy that is desired. So it helps the family to also give birth to the number of families they can take care of. Like even the Bible does. I think even the Bible said that the man that cannot take care of his child is as good as an infidel. So that means the Bible indirectly have told you to family plan, so that we should find a way to understand that family planning is just not, it's something that should be part of us, because you cannot give birth to what you cannot take care of. So find a method that suits you. Find an option that you're comfortable with. But family planning is an ideal for every family. Yeah.
Now, you also mentioned finding a method or option that suits you. Now, can you take us through the available methods that are here in the society today? Because I know for men, we only have one, but there are two, but everybody choose one. So can you just take us through some of the available contraceptive methods that are here?
Yeah, thank you. So I think when it comes to contraception and contraceptive method, it depends on what the patient wants or the providers can also provide. So based on what the patient wants, there's the reversible ones and the non-reversible ones. There are pills. So under the reversible ones, now you will now have the oral pills, the oral contraceptives, the progesterone only, and the combined. You also have the injectables, the injections like the Depo-Provera, and the common Cyanopress that I think is already phasing out now. Then those ones can last. They don't last long. The oral contraceptive, you need to take them daily. The injectables are some ones are every 2 months or every 3 months. You now have the implant, the one you insert just under the skin. Some last for 3 years, some last for 5 years. Then you now have the IUD, the one you insert into the woman's womb, that can last up to 10 years, and they're all reversible. Then the Oga Patapata of all them is not reversible. For the men, you have the sterilization, and for the woman, you have the BTL. Then the only one that can make you prevent STIs and also contraceptive is the condoms. So you have the female condoms or the male condoms. You might also have the diaphragm and things. Then spermicide, those ones are really just, but the effective ones we're talking about are the main contraceptives, the pills or the injectables and the insertions and condoms.
Okay, so now can you also take us through some of the misconceptions that you might have heard in your journey as a public health care provider? Because trust me, even if we keep on emphasizing the importance and benefits of these contraceptive methods, modern contraceptive methods, if we do not address the misconceptions, there is still a lingering barrier.
Yeah, that's very, very good, because when I was in Abia, we did what we call a myth booster. We have to produce a booklet we have to do research to get all the common myths and misconceptions in Abia and answer all the questions. So when we go to the community, I try to answer all the questions. I tell them to ask me all your questions. So the commonest one first is that most of the family planning methods, like the implant and injectables, after a long period of time, the woman stops seeing her period. So people think that the period is blocked somewhere and is causing one problem. No, it's not blocked anywhere. The body have sensed that there's no need to continue your monthly cycle and have ceased the process. Once you stop them, within weeks or months, it will come back. So they have this misconception that the period is packing, the blood is packing somewhere.
Mm.
Then there's this misconception of people that say that they know people that took IUD and the baby came out with the IUD with
Hmm.
while being delivered. That misconception, I had it from my medical school days in Abia, in Akwa Ibom, all the places I worked with. I just had. But the truth is that yeah, IUD obviously is very effective, but sometimes it can dislodge. And that's why you tell the woman to always feel the thread in the morning. So when it dislodges, it can be removed and reinserted well again. Then there's a misconception of family planning causing cancer. So though family planning methods like oral pills can increase the risk of cancer by maybe some percentage, then there's also a misconception of family planning causing obesity. Family planning can cause an increase in weight, but really obesity, no, not that. But a woman can increase weight, and it can be attributed to many factors. A woman that is more relaxed, having sex freely, can just be happy, and that is why she's adding weight. Naturally, even you, without using family planning, you add weight. So those weights are not really that as what they try to paint it black. Then you have the issue of bleeding. Is yeah, family planning has a side effect of bleeding, but sometimes the woman exaggerated. Though some people might have extensive bleeding, but when you have such, you come to the hospital. There is treatment for you. There is investigation to do to rule out some things and now treat you well. And then there's a misconception that family planning can cause infertility. No, that's the lie. Family planning is meant to delay fertility. It doesn't stop your fertility. It can even correct fertility in some places. Or some fertility issues, you might need to use oral pills to correct your cycles to be normal. So I think the commonest one, as I said, is the menstrual period not coming out, and they feel that there's a problem, and the issue of efficacy. Yeah.
So, are there any notable success stories or programs that have made a significant impact in promoting reproductive health and also family planning options here in Nigeria?
Yeah, the last program I worked with was the Challenge Initiative. They actually made a very huge impact in Abia, and I think they're currently in Akwa Ibom now. Yeah, is a demand driven agenda where we try to create demand in the community by sensitizing the women and also provide the services. We try also to train the nurses and make services available, and also sometimes we might go as far as renovating the hospitals to make them provide quality care services. So programs like that, they are funded by Bill and Melinda Gates. I have actually done a lot in Nigeria to improve family planning, and they're very sustainable because they try to work with the state's resources, not using their personal resources. So they use less staff, maybe one or two, but using the main agencies of the state, like the nurses and the Ministry of Health, carrying them along, ensuring that when you pull out your resources, they are there. So I think I'll give it to the TCI, the Challenge Initiative. They actually done a lot in states where they are working, and they do like a kind of counterpart funding with the state government.
All right. So before you go, because of time, how can individuals support the goals of World Contraception Day and contribute to the empowerment of individuals in making informed choices about their reproductive health?
So I think first for us, youth, we should find a way to find access to family planning services around us. Even if you don't want to use it, try to know what it's all about. Build the information for yourself. For the community, for the religious leaders, inculcate for family planning services and counseling in your teachings during your wedding. I think there's this wedding talk they usually give before wedding. Try to, like, even if you're not learned, you can bring a doctor, a nurse, a midwife that knows family planning to talk to them about family planning services. Make more access to them to hear the right information. Don't block people from hearing the information because your faith doesn't accept it. That is not fair. So like give people the right information about family planning. Allow them to access family planning services. Family planning services doesn't spoil the lady. No. It's her character that spoils her, not the family planning service. So allow the lady to have access to family planning services, to have the information she needs. Then men should also support their wife when they want to make that decision. It's called the family planning. So the family should sit down together and know what works for them and go together and assess it together. Yeah.
Thank you so much, Dr. Ikechukwu Okpara, for being a part of the conversation today.
You're welcome. Thanks, Mary.
All
for
right.
having me.
All right. So that was Dr. Ikechukwu Okpara, who is an expert in reproductive health and a passionate advocate for informed family planning choices. Thank you so much for being a part of the show. Remember that you could also be a part of this family by following us on all our social media platforms at Spectrum TV, or you can visit our website at spectrumtv.ng. Until next time, remember that the power of options is in your hands, and also your choice matter. Stay informed, stay empowered, and take control of your reproductive health. My name is Mary Joseph. Do enjoy the rest of your day.